basic life support. Basic life support is basically a way of sustaining the life of a person who has stopped his or her heart and the lungs. So when someone is in a condition where both the heart and the lungs, they are not working, they have stopped working, and you are to restore them back to the normal using nothing but yourself. So that primitive way of restoring the cardiac and the respiratory activity back to the normal is known as BLS, or basic life support. So today's topic is the basic life support, or very famously known as BLS. BLS, basic life support. So let's talk about it. Basic life support. The venue of the basic life support is not the hospital. This is outside of the hospital. It can be in a market, it can be in any ceremony, any gathering, any functions where people are there, and any one of the patient actually collapses. Patient becomes unconscious, and the persons who know how to perform the basic life support or the BLS, they approach the patient, and this is an approach which should be learned by all persons. This is not restricted to the doctors, not to the persons who are related with the healthcare facilities, but this should be learned by everyone or all members of the society. So what happens that if someone collapses or just knocks down, the person who knows a little bit about BLS or the ABC of the BLS approaches the person. If the person who had approached a collapsed person knows the name of the person, then one should call or shout by the name of the person. But if one is not familiar, one should try to shout on the face of the patient, Miss or Mrs. or Mr. If there is no response from the patient and patient is unconscious, immediately check the carotid pulse. It should be checked parallel to the thyroid, and one should place 3 fingers just parallel to the thyroid in the neck area. If there is carotid pulsation, that means heart is pumping. But if there is no carotid pulsation, then the BLS starts. If there is a carotid pulsation, you will simply turn the patient on the lateral side. You will simply put the patient on one side, so that if patient is about to vomit or vomitis something, it should come out of the oral cavity rather than being aspirated down to the lungs. So in those cases where you see that the carotid pulsation is there, then you should try to look for the breathing. If there is a breathing, then it's okay, just put the patient on the left side or the right side towards the lateral side. Ask for the help, like in Pakistan we call rescue 1122. In America you call 911. In every country has got its own code for the emergency services. So immediately call the emergency services so the patient can be shifted to the hospital. But in those cases where you do not find the carotid pulsation, immediately ask someone to call the emergency medical services and start BLS. Now the BLS has got 2 components. Obviously here 2 vital organs which sustain our lives, which has got their center located in the medulla oblongata, they are stopped. One is the cardiac activity and one is the respiratory activity. Patient is not breathing and there is no carotid pulsation, means only one thing: either the heart has stopped or it's such a feeble pulsation of the carotid that you cannot feel. In both of those circumstances where either there is an absent carotid pulsation or you are not able to feel it, you will immediately start BLS, which has got 2 components. Component A is cardiac, or it is compression component. And component B is respiratory component or lungs component. You can also call it a breathing component. So whenever you are to do BLS, basic life support. And I will repeat one thing, it should be learned by every member of the society. If one wishes to save one's life, it will make a huge difference. So when we start the BLS on a patient who's unconscious and carotid activity or pulsation is not palpable, you will start the cardiac component and the respiratory component. In the cardiac component, there comes the breathing compression. What you do in the compression component, that this is the sternum of the patient. This is the sternum of the patient, and say these are clavicles, and this is the chest of the patient. So what you do in the compression of the patient, that you just outstretch your elbows, you keep them straight. Then, for example, I'm a right-handed person. I have got this limb as a, or forearm as a dominant hand. I'll place this on the sternum. In the middle of the sternum, I'll place the heel of this palm on of my right hand in the middle or center of the sternum. Then I'll entangle these fingers with the fingers of the non-dominant hand, and I'll outstretch my elbows and forearms. I will not flex my forearms on the elbows, but I'll keep them straight like this. I will not make them like this. I'll keep them this, and this palm, heel of this palm will be in the center of the sternum. Sternum starts from here. This is the suprasternal notch, and it goes all the way down to the middle of the abdomen. So where there is a xiphoid sternum. So you put the palm of your dominant hand in the middle of the sternum here. You entangle fingers of the non-dominant hand, and you just make your shoulders to come right on top of the chest of the patient. You bring these right on top of the chest of the patient, and then you start compressing down. You should compress forcefully. These should be at least 2.5 inches, but obviously you can only assess the depth of the compressions by practicing it at your own home or offices or wherever BLS is actually planned to be taught. So you should straighten out your arms, you should extend on your elbows, you should place the heel of the dominant hand on in the center of the sternum, entangle the fingers of the non-dominant hand within the fingers of the dominant hand. You should have your shoulders right on top of the chest of the patient, and you should start compressing. These should be hard and fast. While you are practicing it during the peace time, then try to keep a watch on and make these compression 100 per minute. This just to know the speed of the compression. Otherwise, here you are to give 30 compressions. You will give 30 compressions. These should be hard and fast. You give 30 compressions. Which should be hard and fast. Okay. You give 30 compressions with your dominant hand on the sternum, your shoulders on top of the patient's chest, and you just keep on pushing. You give 30 compressions at one time. And just to talk about the speed of the compression, when you are practicing it at home or in your hospital or in your offices, because these sessions should be arranged everywhere in the society. So you should have a watch on, and you should try to synchronize with the seconds. I mean, 100 compressions should be delivered in 1 minute. If you do it more than like 10 times, it will be your sort of reflexes that what should be the speed of the compressions. But here, when we are doing the BLS, we give 30 compressions. Then after 30 compression, we know that this patient is not breathing. If we are alone or if we have got someone with us, we will ask the person who's standing with us, or we will do it ourselves, that we will pinch the nose of the patient and we'll seal our lips with the person's lips, and then we will give 2 breaths. We are to give 2 forceful breaths. So after every 30 compressions, you will give 2 breaths. 2 breaths. 30 compression and 2 breaths. So this is very important to know the technique of how to compress the chest of a person who is unconscious, has got no carotid pulsation, and you suppose that the patient's heart has stopped and patient is not breathing anymore. You are to do the basic life support. You are to resuscitate the heart and the lungs of the patient back to the normal, or you are to try. But at that very time, you are to do one very important thing: ask someone, or if you are alone, immediately call the emergency medical services. You are not supposed to keep it doing all the day. You are supposed to just fill the gap between the happening of the incident and arrival of the medical services. So you will compress it 30 times, 30 times hard and fast. Hard and fast. Hard and fast. Hard means depth needs to be around 2.5 inches and rate should be somewhere around 100 per minute, and this is what we practice before this actual execution of our expertise. Now we do the 30 compressions and then we give 2 breaths, either ourselves or we ask someone to give the mouth to mouth breathing. We seal our lips with the person's lips, pinch the nose, and then give 2 breaths, mouth to mouth breathing. Now there are two very important points. One, people are scared that they can break the ribs of the person on whom they are doing the BLS. Now the question arises, if the patient survives, the ribs can be managed later on, and in majority of the damage to the ribs, there is no damage to the lungs most of the time. But if patient doesn't survive, there is no use of saving the ribs of the patient, one thing. Secondly, there is a sort of stigma if the person who has become unconscious has got a pulmonary TB, the person who's doing the BLS can catch it. No, one cannot catch it, because when is giving the breath, patient, the person is not catching the breath from the patient, but is giving breath to the patient. So there are least chances of getting any pulmonary TB or any lungs infection. But even if there is a scare of it, one can place a very small cloth or anything like the gauze piece or whatever one has got, just to psychologically get rid of that scare. Secondly, thirdly, if the person who's doing the BLS has got a pulmonary TB, for example, and there is a scare that the person who's being practiced this BLS, or who is in need of the BLS, may catch this pulmonary TB from the person who's doing it. The question is, what if one survives? Pulmonary TB is a treatable disease. But if because of this scare the person is not doing the BLS on that person, then there is no use of and the person dies, so then this scare is baseless and it's false. So we give 30 compression 2 breath, 30 compression 2 breath. We give it 5 times. We do the 5 sessions of 30 compression 2 breath, 30 to 2, 30 compression and 2 breaths. We do it 5 times, 5 times. Then once we have done it 5 times, that we have given 30 compressions and we have given 2 breaths and we have done it for 5 times, then we check the carotid again. Check carotid again. Carotid again. If there is a carotid pulsation, carotid pulsation, stop the BLS, basic life support, or the cardiac compression. And if patient is breathing, just put the patient on one side. Turn the patient towards the lateral side, right or left, especially the left side, so that patient does not aspirate the gastric contents. And if the patient is breathing and heart is working and there is a carotid pulsation, then it's fine. But if the person is not breathing but there is only cardiac activity, just keep on giving breaths after every 5 or 6 seconds. Give almost 10 to 15 breaths per minute, but there are chances that once the carotid pulsation is back, patient will also start breathing. So this is 30 to 2 compression. This is a very important part of the basic life support. Now there is also another question, when to stop this BLS. Okay, this is again a very important question, that when one is supposed to stop BLS. When to stop BLS. Okay, there are chances that by the time you are doing it around like 10 minutes, 15 minutes or 20 minutes, there would be emergency medical services. Once they approach there, they will start from the BLS, they will convert it into ACLS. Chances are that they will convert it. Nowadays the emergency medical services, they are so much expert in these kind of stuff that they will switch from BLS to ACLS, which we will talk later on in other video. But here, if they are not expert enough to convert the BLS into the ACLS, then they will took the patient in the ambulance. They will just keep on doing the basic life support, the compression and the breathing, and they will take the patient to the hospital where ACLS will be started. But you are supposed to keep on doing the BLS as long as there are emergency medical services haven't reached there. They reach and they take control of the patient and the BLS. Second chance is that you have done it more than like 45 minutes. You have done it more than 45 minutes. There is no cardiac activity and there is no breathing activity and no EMS have approached. No EMS available. So if you are doing it for almost 30 to 45 minutes or beyond, there is no emergency medical services available, they haven't reached you, you are somewhere in an area where you think that they will not be able to make it to you in like 1 hour or so, then you will have to stop the BLS. And if there is no restoration of the cardiac and the breathing activity, chances are the patient will not make it. But there are some exceptions. If patient is a case of drowning, if patient is a case of hypothermia, you are to do the BLS for a longer period of time. Because in cases of the hypothermia and drowning, most of the time there are some subclinical activity going on, and if you do not give up on BLS, chances are that patient can make it to the life. So in those cases where you have hypothermia and you have got case of a drowning, try to maximize your duration of the basic life support. I hope it gives some idea of the basic life support, and there are some pearls of the basic life support. Let's talk about them. It would be just a brief discussion about the pearls of the basic life support. What are the pearls? Pearls of basic life support. Number 1, assess immediately. Assess immediately. Number 2, if no response, start BLS immediately. Number 3, asks someone to call EMS number like 911 in America immediately. Try to focus more and more on chest compressions. Chest compression. So these are some of the pearls of the BLS that you should assess the person immediately. If there is a no response from the person, you should start the BSL very immediately. Ask someone to call EMS, emergency medical services like 911 in America, 1122 in Pakistan immediately. Try to focus more and more on the quality of the chest compression. Make it hard and fast. It saves life. If you are not able to give the breathing and you are alone in this venture of like basic life support, try to focus more on the chest compression. Nowadays, there is a concept of compression only CPR. Nowadays, there is a concept of compression only CPR. Compression only CPR. If you are alone, and think you may exhaust early, then only focus on chest compression. Then only focus on chest compressions. If you are alone and think you may exhaust early, then only focus on chest compression. Ask someone to call 911 or 1122. But try to focus on the compressions because it may save life. Try to be hard and fast. Hard and fast. How will you do it? You will practice it. If you practice in groups, if you practice it individually, that is the only way to learn it. You cannot expect that the day something happens, the day you are supposed to do it for the very first time, you will be able to execute it properly. That is not a possibility. In whatever skills you are, 90% of your time should go to the practice of that skill, and only 5 to 10% goes for its real execution at some proper time. Take the example of Usain Bolt. People know him as a 100-meter race winner, the fastest person in the world. But they don't know that 95% of his lifetime he has spent in practicing to achieve this greatness. So that goes to every skill. Whatever you are trying to learn, try to spend as much time as possible in practicing it. And once you have learned it, then one day you will be able to execute it very properly. You can make it hard. That means depth will be 2.5 inches at least. You can make it fast. That means it may be 100 compressions per minute. Roughly that will be the frequency. And you can take a very good care of different things. That you can focus more on the compression. You can manage somehow to give number of breaths. Like if it is possible, try to make it 30 compression, 2 breaths, 30 compression, 2 breaths, 30 compression, 2 breaths, 30 compression, 2 breaths, 30 compression, 2 breaths. This is a 5 session set. Once you have done it 5 times, again check the carotid. If there is a carotid, you may stop the CPR, you may stop the BLS, you may stop the compressions, and then try to look for the breath of the patient. There may or may not be. If there is no breath, try to just keep on giving. After every like 5 seconds, give one breath. That goes around like 5 to 12 breaths in 1 minute. But if there is no carotid pulsation, again repeat a session of 30 compression, 2 breaths, 5 more times. Once you have done it 5 more times, then again go back to the checking of the carotid pulsation, and do not spend more than 5 to 10 seconds to check the carotid pulsation. There is always a scare in the doctors that what if there was a carotid pulsation but I couldn't feel it, and then I do the compression. It is not going to harm the patient. If you cannot feel it, you are in doubt that whether this is present or not, but patient is not responding, then do the chest compression. But for example, if you were in doubt that there may or may not be the carotid pulsation, and actually there were no carotid pulsation, then the person can die of it. So if you are in doubt, go for it. If there is no pulsation, go for it. Only if you can feel a very proper pulse, only then stop BLS, and only then stop doing the chest compression. So it gives some idea of the BLS. As per my experience, majority members of any society should know how to execute it, because now in nowadays world we have got so many cardiac patients, and most of these somewhere, sometime in their life, within certain minutes period, they will have a cardiac arrhythmia. And if BLS can be executed within seconds to minutes, chances are that this patient can make it to the hospital. And there, if they perform the ACLS properly, chances are that patient can make it to the life. So that makes a huge difference between the life and death. So learning BLS is one of the very important tasks in every person's life, rather not only restricted to the doctors, nurses, or other healthcare facility related persons. So this is the concept of